Welcome to the Keto Diet Guide channel. On this channel we discuss helpful tips and tricks when it comes to doing the keto diet. Today we'll be discussing: how does keto diet work? The keto diet is a very high-fat and low-carbohydrate diet, through which the body switches to a non-energy-deficient hunger metabolism and increasingly forms ketone bodies in the liver. The ketogenic diet is primarily used to treat pharmacoresistant epilepsy in children and adolescents. The menu is already being used successfully as an additional therapy for epilepsy in children and adolescents. Recent studies have also made therapy success in Alzheimer's seem possible. A non-medical form of the ketogenic diet is the so-called low-carb diet. People mainly use it for weight loss. How does our metabolism work? The metabolism describes all chemical processes that take place within our body cells and control vital processes in our body. Such includes, for example, sleep, wakefulness, growth, muscle building, breathing, and much more. For our metabolism to work and our body functions to run smoothly, our body needs nutrients and energy, which converts or breaks down into enzymes and hormones, but also excretion products and toxins. Our body draws the power for this conversion and dismantling work from the nutrients that we supply it through food. The primary energy suppliers include carbohydrates, fats, and proteins, in which our body converts in the stomach and intestines into glucose, fatty acids, and amino acids and transfers into the blood. Who is the ketogenic diet used for? The ketogenic diet is used primarily in children and adolescents as an additional therapeutic measure under strict medical supervision. Treating infants with a ketogenic diet is possible. Experience has shown that the menu seems to lose effectiveness in children older than 8 to 12 years and is even more difficult to carry out due to the getting used to the diet. In adults, rarely do adults use a ketogenic diet for treatment, and therefore little research has been carried out. How is the keto diet carried out? The diet is carried out under medical and nutritional supervision and should be initiated in the hospital, approx. 5 to 7 days, in a hospital or a suitable institution. Complications, such as digestive problems caused by metabolic change, can be treated quickly. Through the inpatient stay, the patient and his relatives can also be better trained and cared for in dealing with the ketogenic diet. The training is usually carried out by specially trained dietitians and provides the following content, among other things: suitable foods for the ketogenic diet, preparation of ketogenic, i.e., high-fat dishes, control measurement of ketones in urine and blood, how you should deal with dieting errors. You must follow a ketogenic diet strictly and carefully to achieve the desired effect. Well-functioning cooperation between patients, parents or relatives, doctors, and diabetologists is essential for the success of therapy and can only be made optimally in a team. During the diet, the patient's condition must be checked regularly, even after discharge from the hospital. Measurements of blood lipid values, such as total cholesterol, triglycerides, LDL cholesterol, and HDL cholesterol are also essential, since adverse effects on fat metabolism are described. Besides, the urine and blood ketosis values, similar to a blood sugar check, must be measured or monitored using a test strip and measuring device, as well as the patient's blood gases. After about 2 to 3 months of a consistent diet, the effectiveness of ketosis in the body is accessible. Medications for the treatment of epilepsy in children and adolescents are, therefore, usually continued when the diet is started and only slowly reduced if successful. How is the ketogenic diet structured? In the ketogenic diet, carbohydrates, which are components in bread, pasta, potatoes, or sugar, are significantly reduced. At the same time, the intake of fats from meat, fish, and healthy oils substantially increases. The body changes over time to a kind of hunger metabolism, produces more ketone bodies, and comes into ketosis. Before starting any ketogenic diet, it is essential to determine or calculate the exact energy and protein requirements, depending on age and energy expenditure, of the patient to be able to adapt the diet or the nutritional plan individually. The exact weight ratio, the ketogenic ratio of fat to carbohydrates and proteins is calculated. A ketogenic ratio of 4 to 1 means, for example, that the total amount of food in the diet must be 80% fat. Depending on age, the remaining 20% must contain the amount of protein that is needed. The amount of carbohydrates is reduced to a minimum and enables sufficient ketosis balance in the body. Multivitamins, minerals, and trace elements such as calcium are also taken in the form of carbohydrate-free preparations to avoid deficiency conditions. For more helpful tips for people trying to master the keto diet, check out the links in the description, or if you're interested in getting a custom keto diet test to see if the keto diet is right for you. Also, be sure to like, comment and subscribe to our channel. Have a great day.